Many of you may not know me. I am Shashi Rekha. I am a professor of computer science in the Department of Computer Science, and I am here for the past 27 years. First 3 days I could not join this FDP, so from yesterday I am here. So we are on the 5th day. Yeah, today we have with us, ಇದು ಶೋಕುಡಿ ಐತೆ ಆನಂದ್ ಇದಾಗ್ತಿದೆ ಸಣ್ಣ ಇದು. Today we have with us Dr. B.G. Ponnappa. I mean, you can see his qualifications there. Right now, he is a medical superintendent and consultant surgeon at Suyog Hospital, Mysore. Maybe some of the participants may be from Mysore. You may know about Suyog Hospital. According to what he has given, he has MBBS degree, DNB, general surgery, MNA, MS. He has to tell me what are those. FRCS, FIAGS, FIMSA. Not only that, many of us, even in some cases with utmost difficulty, we might have acquired 1 or 2 degrees. He also has LLB degree to his credit with first rank and 4 gold medals. Not only that, he also has an LLM in crimes and torts. He also has MBA degree to his credit in hospital management. Not only that, he is also a journalist, as he has the mass communication and journalism degree with again first rank and 2 gold medals. When I asked him about this, he said what I can teach, what I can say. Added to that, he is also having a diploma in web application programming, and he has worked as assistant professor in the Department of Surgery in medical colleges in India, and also as consultant general and laparoscopic surgeon in St. Lucia and Ajman. He has to his credit about 20 scientific papers presented in India, West Indies, UAE, Mauritius and Spain, about 30 articles published in various medical journals. Not only that, he has delivered guest lectures in various medical colleges about legal aspects, medico-legal topics for MA Criminology, MSc Criminology, BSc and MSc Nursing, BDS, LLB, MBA, HM students of various colleges, universities, and even at Police Academy, Mysore. In addition to this, what I know is he is also a farmer. He also plays flute. Maybe other things he has to tell me. Now, in spite of all these qualifications and in spite of all this busy schedule, you know how much free he is. So, thank you very much for accepting our invitation and being with us this morning. So, I welcome Dr. B.G. Ponnappa to this FDP on behalf of Department of Computer Science and all the participants, and also I personally welcome Dr. B.G. Ponnappa. Welcome you. So, the session is yours.
Suprabhatam to all of you. It's morning 10 o'clock. It's a cool room, and I didn't get one response to my Suprabhatam to you. Please say good morning or Suprabhatam, Shubhodaya, Shubhodina, something like that, so I can gel with you. Good morning. Thank you. I really appreciate that. All right. I think one more standard dialogue which I use with my other forums is, please switch off your mobile or keep it in silent. Seniors can take the calls because there may be pressures coming from elsewhere, but not for the rest. Because I find most of our people who will not be interested will be either chatting or WhatsApp, Facebook, and they'll be pretending as if they are listening to my lecture. So if I have to gel with you, you'll have to gel with me. I may be a little arrogant at sometimes, right? So please forgive me. I'll apologize again at the end of the session. But before that, I don't want you to feel, man, this fellow is so. Everyone is knowing Kannada here? Anyone other than Kannada? Okay. Malayalam. Right. Who else? Where are you from? Chandigarh. Okay, Hindi and Bangalore. समझ में आता है ना गाना? All right. Because some of the things it will just touch your heart only when I use the local language. So that's what I thought I'll just tell. Here, imaging loves maths. Actually, the title earlier was Maths Love Imaging, and then Dr. Shashireka says, we already love medicine, but whether medicine loves mathematics, that's the question, so we'll change it. Right, having said that, I'm very happy and grateful to Professor Shekhar and Shashireka for having invited me. I don't know, now you people will be evaluating me and I'll know where I stand. It is in my home situation, it is a different ball game. The first time in my life, 53 years, I am standing in front of geeks. I don't know, are you all geeks? Not all? Some? All right. So this is Om Shri Gurubhyo Namaha. Om Sahanavatu, Sahanau Bhunaktu, Sahaviryam Karavavai, Tejasvi Navadhita, Mahavidvishavahe, Om Shanti, Shanti, Shanti. I'm pretty sure most of us have heard this shloka. For anything and everything, there is a Guru. We cannot be without Guru. So all due respects to the first Guru, which is Shiva himself. Right? You can see in this figure, he has this apasmara, ignorance, dwarf, and he is standing on that dwarf. So he is imparting knowledge to the Sanat Kumaras. So it has, the figure itself has a lot of significance. When we drive our vehicle, there is a dog coming in suddenly and instinctively we turn either right or left or try to avoid it. Who taught you that? Never in my driving school. But suddenly we take a decision, that split decision, who has given you? Do we have a machine language programmed in us to, okay, dog coming at this distance, turn right, turn left? No, that's the Guru which is telling us. So, paying our respects and honor to the Guru. Next, Vakratunda Mahakaya Suryakoti Samaprabha Nirvignam Kurume Deva Sarvakaryeshu Sarvada. I don't know whether there is Vigna for you people from my talk. I don't want you people to become Vigna for my talk. So let me pray Lord Ganesha also. He's supposed to be super intelligent. And today's topic, that previous slide I showed you, loves. In Japanese, it is called AI. AI, Japanese is love, right? So here we have a super intelligent human being, supposed to be human, then he gets a head transplant. I don't know if a head transplant, if my head is transplanted onto Dr. Shekhar, and I don't know whether I'll continue to be Ponnappa or continue to be Shekhar. So somewhere, but this is how things go. To begin on a lighter vein, just to warm you up, I put these slides. Disclosure, I don't have anything to disclose. Most material is intelligently copied and pasted, not mine. Maybe some element may be there, but most of it is, that's why you people are being trained now, artificial intelligence, you'll have to do such things. I am an expert, I don't know in which, artificially intelligent in the domain. I am not intelligent like you people in your domain, but I am a bit artificially intelligent. She was telling about some web designing and all those things. I have that Java, SQL, C, C++ and all that. I've written my engineering exam also in chemical engineering, but I didn't pass. I cut short. There computer science also was a topic, so alpa solpa knowledge I know. And thanks to Dr. Shashireka and the HOD, Professor Shekhar, Dr. Lala, Professor. Right. Right. I was made to understand. I was just asking what type of audience we have here. If all are super intelligent, then there's no point. If I have to show off, then there must be some elements where I can show off. So I asked them, they said that it is mostly postgraduates and PhD scholars, a few professors and associates. So I thought I can handle this. So if I'm wrong, please involve, talk to me. It should not be like I have oral diarrhea and you have mental constipation. You sit like that for 3 hours and I go on blabbering. So it doesn't help. So I would appreciate if you can stop. Even if I don't complete the slides, it doesn't matter. It's at the end of the day, this comradeship will develop. So imaging medicine. I presume this FDP is all about imaging. And you people are purely computer science specialists, so you might not. That's what I was made to understand. So a brief look into my profession as to how it is. So if you want to have a plan in developing some applications to the medical field, probably some background. So I'll just give you what my profession, the medical profession is about. When I started medicine, we have the stethoscope. You have all seen that. In some of the movies, they'll put it here and listen to the heart. It is meant to be put to the ear and here. And in those days, they used to tell, this is a cardiac murmur, mitral valve stenosis, it is a mid-systolic murmur. What is that? They'll put the stethoscope, my professor used to put the stethoscope and say, you hear, you sir? Yeah, I do hear. I don't know what it is. But now we have come to a ultrasonography, echo, where we'll know where the murmur is, where the sound is originating, at which point, is it stenosis or it is regurgitation, we'll be able to appreciate. 20, 30 years back we didn't have, we were just depending on our intelligence. Library. We used to go to the library at 7, 8 o'clock, pull out all the books for one small question. Our professors usually, when we ask a question, oh, that's a good question. Why don't you present it tomorrow? Well, now you people have Chat GPT, Google, go key in the words and you have your information right on hand. But here we don't know which book offers that subject. We'll have to, I think the same goes to our, and now we have an idiotic phone. And it has, I'm sorry, that's a smartphone, but it has made us idiots. For everything we go to the smartphone and eventually, can anyone tell me 14 tables, 19 tables? So all our neurons are getting atrophied because of smartphones. Bedside clinics. By the side of the patient, we used to touch, feel, hear, and then come to a conclusion. Now our students don't come to the hospital, and our principal will say, "Sir, pass madbudi, sir." And then tomorrow a big cutout will be there, 99% of marks secured by this, 100% pass. We'll scratch our head. Who taught them? Not me. But they get 100%. So this is the system. Can't help. That's how it is. X-ray, you people know, ECG, urine motion. That was the thing we used to do. Once, before I went into my post-graduation, I was having a clinic in Brindavan Garden, Mysore, KRS. One of the patients had some problem, so I asked him to bring a stool sample, that is kaka sample. So next day he brings and keeps a half kg on my table. Sir, I was just wondering, where did I make a mistake? Sample, he brought the entire sample. And we have the problem to analyze all that thing, and some people might have this experience, stool analysis, take it in a matchbox or a glass bottle and bring it to us. And what a dirty job we are. People say, doctor, what is this? You people, the luxury of having an AC room and coffee and great. I envy you people. Now we have this CT, MRI, PET scan and all those things. Abdomen is supposed to be Pandora's box. We don't know what's there. Clinically, in my time, we just had to palpate, figure out what the problem is, and make a tentative diagnosis, and take the patient to operating room. When we open, it is totally different, something else. But having opened, we'll have to attend to it. We don't have any choice. We had to do it. But now we have a peek inside. Before going inside, we have some scans which will know what the problem is, and we are ready. And the most beautiful part is no consumer code there. Now India will not get statistics, proper statistics. In USA, they say there's 10 million diagnostic errors. So imagine if all the errors combine and kill people, what happens? Earlier, doc was God. My father is also a surgeon. When patients die, they used to come home on half kg benne. Togondo, sir, this is what we can offer to you. Thank you for killing treating the patient died, but it's not your fault, thank you very much. Kaal hiddu, they used to go. But now, GOD is DOG. Now, for anything and everything, they'll bring a dead patient. Sir, nurse, needle hakudlu satoda patient. Patient is already dead, but for having done something, it's all compensation mentality. Victim cards. Some money they'll have to swindle. They know doctor has a big pocket. The doctor will get a big pocket of 30-40 years. Earlier they used to say, I am for service. No more it is service situation, because politicians, Swamijis, all contractors opening medical colleges, how do you expect service there? Service is only money now. So you pay, that's it. We'll treat you accordingly. So we have, if you go to a roadside canteen wala, dabba wala, he'll give you a chai for 5 rupees, 10 rupees. If you go to a hotel, it may be 20 rupees. If you go to a star hotel, it will be Starbucks and all 200, 300 rupees. What is there? The same coffee. So the same treatment. Treatment will be the same, but as we go, I'll tell you. Why I am telling all this thing is to give you an insight as to how this profession is. Is there anything where you can contribute to this profession from your side? So if you can do, I think the purpose of my talk will be served. This is how we used to examine those days. Now it is totally obsolete, because patients write, he touched me in a wrong sense. What is that? They have a breast lump. We go and palpate the breast and they say, oh, he touched me, yaar. So we have to do certain things, but at the same time, left and right, can I ask you, one of you to come and strip it down in front of me? No, you won't. But you want come to my clinic or a hospital. If I have to strip you down, I will strip you down. If I have to stick my finger, I stick my finger. There it is all okay. That's how the things are. Because why a doctor is wearing a white coat is, you see, behind all gods and this thing, that white thing is there, sanctity, purity, trust. Because you people come to doctor, or patients come to doctor because God has failed them. God is not able to help them. So the next best is doctor. So there they are surrendering to you, the doctor. So we'll have to treat them accordingly, respect their privacy, respect all this thing. But now it has become business. So when you expect service and business, it's very difficult to go hand in hand, right? This is how we were examining. This is our artificial intelligence, machine reading. This is how supervised learning, all those things which you do on your computers, that's how they have loaded information into our brains. Any donkey will get experience. You work in the department for 10 years, 20 years, you have an experience. Wow, great, man. But wisdom, not all donkeys will get. You can teach a chimpanzee to operate. But when to operate and when not to operate, chimpanzee will never ever do. Is it the same situation for artificial intelligence? You can teach it a lot of things, but when to apply, when not to apply, will it be able to do it? I think as of now, it may not be the situation. So certain examples which I have given just to make you accustomed to the medical field. There was this doctor in a rural area. He had this patient who came with pain abdomen, and he is treating with the diagnosis of pancreatitis. Means there's an organ called pancreas that is inflamed. So he's treating. So I visit weekly to that place. So when I went, he gave me the X-ray. Sir, this is a pancreatitis. Please advise. That was a perforation of the stomach. The stomach had perforated, there is a hole in the stomach and gas has come out, and he is wrongly treating him as pancreatitis. So there's a negligence involved there. But that's how he is competent. We cannot tell he is not competent to do that, because all the people, there are so many medical colleges here, everyone, the moment they MBBS, they start writing for their PG exams. The moment they finish the exam, they are off to some other country. They would have invested so much money into it. Why should they come and see this dirty? Another thing is, like when there's an accident, they say, what is the first thing which you have to do? First aid. If the patient is not breathing, give a mouth-to-mouth resuscitation. How many of you will give a mouth-to-mouth resuscitation for a patient who is not breathing? Anyone? Theory said, but doctors have done that. Okay, if it's a beautiful girl or a handsome guy, fine, no problem in giving a mouth-to-mouth respiration. But if it's an alcoholic with pan chewing and vomiters in their mouth and he is not breathing, will you go give mouth-to-mouth resuscitation? Not possible. But textbooks say this is how you have to resuscitate. How to do then? Well, we will have to individualize, customize, and that's what you people also do in artificial intelligence. You'll have to train for certain things. So this is a practical thing here. Everyone will see the beautiful picture of medicine on one side, but all the dirty things which I'm telling you, no one says. But that's the profession which we are working in. Both legs fracture. There are two bones in this leg here, and the patient had both bones fracture. He has gone to 3 hospitals, 3 doctors, multiple, and everyone has made a diagnosis of cellulitis. Cellulitis is infection. A leg is swollen, painful, he is unable to walk. They have taken an X-ray of the foot they have taken. Right? This is the leg broken here, but they have taken the X-ray of the foot and made a diagnosis of cellulitis, and they given antibiotics, 3 weeks. And finally they said, the patient is not feeling well, the best thing is parcel, higher center, go bidi, illi agadilla, it's too complicated, you go there. I got a call and I was just, I said, okay, tomorrow cellulitis, what's there? It's an easy thing, tomorrow I'll see. Tomorrow I went and I was examining the patient. Why I'm telling all this thing is, your investigations will not help unless you know what to ask for. So I went and asked the patient what happened. Sir, pain, the same old drama here. I asked him to lift his leg dropped. My diagnosis is there. And I got an X-ray done. X-ray of the leg. You have both bones fractured. Fixed, and the patient is fine. So artificial intelligence, if you don't give the right data, your output will be something. How can it be intelligent when you have given the data which is wrong and expect it to be intelligent? Poor thing, it will not do, right? So fractured ribs versus 3D. Now earlier X-ray we used to have very difficult to find a fractured rib. Now you have 3D reconstruction in a CT, and we can easily pick up a fracture. Open surgery versus guided surgery. I used to tell, I told you, when we open up, it's a Pandora's box. We don't know what's happening in there. Any organ might be. Can I get you a coffee? Coffee? Shake up, shake up, shake up. Good, good, great. So that's why I'm walking up and down, so that I'll keep you all awake. Now we have guided surgery. We can go straight to where we want to operate. Minimal damage. Lab 3D camera vision, Google Lens, Da Vinci robot. I've been exposed to all these things. Though right now, my trust on them is not as much as I have trust on my fingers and my eyes. But I worked on all these things. Your Da Vinci robot, Google Lens, 3D cameras, and now the topic today is, we have this artificial intelligence. Is it hype or reality? What do you think, sir? Can I have your feedback on this? Is it hype or reality?
We can't say it's a hype, but working in real, if we opt it in a real way, then it will be beneficial, otherwise it will be a drastic.
I think everyone will sit on the fence like that. Na ghar ka na ghat ka. I will go that side and will come this side also. So at the end of the day, what's the point? Yes? So we'll see. Now, just like life, it is very difficult to give conclusive answers to anything. We can go close. Even medicine is not an exact science. It is statistically we have based certain things. Now the trends in medicine is increased patient demand. As I told you, they have vats of money here. They say, okay, I want this treatment. I have insurance. The moment they say insurance, the doctors also, insurance. Gare. So a case which will cost just 30,000 rupees will be 3 lakhs. Right? And the insurance, they'll have a deal, so 10% cuts and all the same, will make it at 2.5. Great. And then chronic disease and resource constraint. I don't know how, these are all, statements or words which are cooked up in a AC room, in an armchair. I don't know where these people get this information from. Resource constraints. They want to construct a medical college in every taluk headquarters, every district headquarters. They'll buy land, they have constructed the building, they'll procure the equipments, and that's it. No doctors, no nurses, no further fine tuning. For a 300 rupees bulb in a medical college, they will have to struggle. All the investment there, suppose if it is 100 crores, 50 will be swaha. Another 50 only they'll show there, and who will maintain the next the building and equipment and all those things. Resource is not a constraint, but where it is channelized is constrained. Increasing digital health technologies, of course, now that is what we are going to explore. It's better to merge, as our friend here said, real nor hype, it is very difficult. It is, well, let's merge and see how things go. Man and woman can't exist separately. They'll have to merge in a marriage, and then similarly here, right? Certain hardcore subjects and the digital thing has to merge, and then we'll see. Computer program versus AI. Continuing, no more system level isolated surgical treatment or anatomical. Earlier, an appendix, we just go take the appendix and leave it. God is there. If he survives, I've done my job. The rest is his. But now it's not like that. We'll have to go in various physiological level. What are the hormonal thing, neurological thing, outcomes, everything we'll have to balance theoretically. When it comes to practice, government hospital is government hospital, and private hospital is private hospital, and super specialty hospital is super specialty hospital. You will cater for every need, but outcome, it's consideration of metabolic, hemodynamic, for the quality of life. Over the years, your this thing is all your cut and paste, right? Supervised algorithms, deep learning, and neural networks. But which all these things, can you give that human touch? Suppose I see some youngsters also here. Suppose I have a love failure. My boy has cheated me. My girl has cheated me. What to do? It's the dukkha is still here. You can't tell, very difficult. You go to your friend, just go to your friend, hold her hand, and just keep your shoulder, head on her shoulder. It's okay, da, chalta hai. It's very difficult. That itself is enough, nothing more. That human touch can your computers give. This mostly seen with the girls, boys, maga, smoke, drink, gata. Dadi, bidi and kudi, and that's how they marriage. But there is again a human element, right? There is also a human element there. So can these artificial things and computers and smartphones provide that security? I was told that the new generation are finding their comforts in these sort of gadgets. No more human, because Papa is elsewhere, Amma is elsewhere, they give a phone here, or put on the television, they'll Whether they understand or not, because that is more important because the hug, the feed is not there anymore. Because the maid servant will be feeding halu to the child. So where do you expect this human touch to come? Medicine, it is something like, it has to be a package. You cannot say one thing and do it. Again, this is your language, I'll not go there. Intelligence, human intelligence comprises of abilities like learning, reasoning, perceiving. I think over the last 2-3 days you have heard that. Artificial intelligence comprises patterns, recognition from text, images and all those things. That's what you are trying to do now. I was talking to this girl and she is telling voice recognition. I was talking to my friend there, he is trying to biometric thing. So everything is some image, some pattern and all those things you are trying to evaluate and see how it's going to change. A synergy between these two will definitely help medicine and patients. So having told about the intelligence, there must be some source there. We have a human brain which has 6 layers of neurons, 100 billion neurons, 4 to 10,000 synapses, that's connections, and that will come to 1,000 trillion connection. I think it's beyond my comprehension. It's such a small 1.5 kg brain, so much connection, so much thing happening there. And coming on your artificial side, the only thing I knew was the CPU. And the other day, our common friend, one Narsimhan from the US had come, we were just talking like that. He says, he told me he is working for NVIDIA. NVIDIA, what do you do there? We do GPUs. What's that GPUs? Graphical processing unit. I said, you're a hardcore mechanical engineer. What are you doing in the computer field? Hey, Angalakno, this thing, cooling. Why are you having this room so cool? Why are you having your computers, labs and all those things to be in a cooler time? Because that also heats up. You need some cooling. Otherwise, if it heats up, what happens to your data? Will it be the same? What about the basic principles of physics? Expansion, contraction, metals. So anything can happen. Your connections can go wrong. So what if that happens? So he is telling for a microchip, his heat transduction and heat transfer, how to do that cooling system, he is into that. So I said, what else can be there? Then I found out there is a TPU, then we have an NPU, and you have an LPU, Grok AI, this is recent, it seems, Grok AI, language processing unit, it is very fast, especially when you are having an interaction, voice to voice, it helps. And then QPU. I should not be talking all these things to you people, so I'll just, again, this is out of purview for me, you rather. Human memory, they say it is 2.5 petabytes. I don't know what that petabyte is. I know only she took my thumb drive, that is a GB, 16 GB thing. That's the max I know about, right? And they say it is GB, PB. Where does it go? Human brain has so much space, and they say it is 300 years of continuous running of TV. Are we using that? What is the end result if we go on with the artificial intelligence? That system will say, Ponnappa, time for your dinner is one robot will come and I open your mouth. Till I die, I'll be like that. Is that what we are foreseeing with this artificial intelligence? And the artificial intelligence is the thing. That's the reason why you people are conducting a program here, and next week in Mysore they are having in microbiology how AI is changing the scenario. So it is exponentially growing. I don't know whether it is good or bad, an individual thing. Brain, it is not just the memory which you people have is in your chip, a small thing which has, but look at the human memory. Apart from the brain, which is memory will be in the cells, there are in the synapses also, in the connections also they say there is memory. Not just that, cellular memory, you have the genes, a muscle tissue will always grow into a muscle tissue. A blood tissue will always grow into a blood tissue. So where is this memory studied in the cell? We don't know yet. The genetic information is fine. Okay, human and all those things. So what are the characters? Okay, that is, we know we have a DNA, RNA, it is encoded there. But what about the other? Evolutionary, from a gorilla we have come to this level. From this level, are we going to an artificial intelligence level where the, all the robots are, that's an evolution, right? Is that the way to go? Karmic memory, we have this Sanchita and Prarabdha in the Hindu philosophy. We think Sanatana Dharma, there is some karmic material. Yesterday I was a dog, tomorrow I may be something. So if I do some good deeds, maybe I'll have a better future, maybe I can go to a different plane. Is it a laughable subject? As of now, science always wants proof. But can we at this point of time give proof for such things? No, but that doesn't mean that doesn't exist. Probably instead of investing on artificial intelligence, we'll have to go retrogress and find out about all those things. Maybe it's a good thing, because those days people were living 700 years, 800 years, or Rishi Munis, even Abraham, Christians, he lived for 750 years. Is it truth? Did they live? How did they live? The astronomical thing which they have detected, your basic computer thing is 0 and 1. Purusha and Prakriti, 1 and 0. Only two things you have, but where all you have gone? With just 0 and 1, 0 and 1, multiples, where have you gone? Can this be those days, the Rishimunis who have identified various parallel universes, multiverses? How did they do? Did they have an artificial computer, artificial intelligence? How did they do? It was all here. Instead of going here, we are going out. Is that the way to go? Heart transplant. Again, where else we have memory? This is one Claire Sylvia, she had a heart transplantation done of a 16-year-old black male. After the operation, she started enjoying KFC and beer for no reason. Earlier she was not interested in it. But after the heart transplantation of that boy, she started craving for this. Why? We think memory and this thing is in our brain, but is memory in the heart also? There's another heart transplant person who, for every lightning and thunder, he gets petrified. And they found out the person who died of whose heart was taken was struck by lightning and he died. So does heart also have a memory? Rebirth. A 6-year-old, you would have seen in the this thing, one 6-year-old boy telling this is how you fly a plane. How did he know how he has to fly the plane? Who taught him? Is it rebirth? Where was this memory stored? Is there a consciousness, super consciousness, which is all around us? Maybe when Dr. Shashireka, I don't know why she invited me for artificial intelligence. Because I was talking to my cousin about 6 months ago about artificial intelligence. We wanted to do some project for him because he's an engineering student. Now he has gone to the UK. He is pursuing robotic artificial intelligence. I was talking to him and I wanted to learn your language, Python. He said, Anna, don't do all those things. You give me the data, I'll do the rest of the things for you. Why do you want to go invest for Python and all those things? And then my friend Narsimhan, NVIDIA, GPU, and then Shashireka calls me and says, why don't you give a talk on, is there some artificial intelligence which is guiding us somewhere here? Is there? Or is it just fluke? Something to think about. I'm pretty sure this has happened to you also somewhere in your life. You want to have something to happen, it doesn't happen. You don't know anything, suddenly out of the blue certain things are going to happen. Is it that super consciousness? Is our mind, just like maybe 10, 15, 20 years ago, if you had told there's a cloud, you can store your all those images and files in cloud, how is it possible? Now see, that's happening. Now you know it can be stored in cloud. Similarly, is our memory also stored in some cloud elsewhere? Is it how we are communicating? Newton saw an apple falling down and say, oh, Newton's law of gravity. We all have seen, but we didn't do that law, Newton's law. How did he do it? was there, say, super conscious intelligence guiding him, because the frequency is set, his password set, his identity set, his biometrics was perfect. Okay, this is the client of which I'll give gravity. Is it possible? I don't know. These things have to be kept in mind. So Max Planck, consciousness is fundamental. Quantum theory, whether I am a particle or I am a wave, it all depends upon the situation. Whether I am here or whether I am there, again it depends upon where I am on that particular situation. We are in this planet, in this moment, in this classroom, maybe for a purpose. Now, comparing the human memory to the AI memory, as latest as last year, December, we have this Frontier supercomputer, which is 9.2 petabyte. 2 or 3 human beings is equal to that supercomputer. But unfortunately, we have divested our information. We don't want to become supercomputers. We are giving it to something else. It costs weight is 270 tons supercomputer, and ours is 1.4. Take 3 or 4 or 5, 10 kilos. Where is 10 kilos? Where is 270 tons? Who constructed this intelligence, structure? Cost involved, of course, millions and millions of dollars. Heat generated. How much heat is generated? It's after all a transistor, a diode, one yes or no, signal present, signal not present. That's what is computer. How much energy it consumes, how much heat it liberates, how much energy is required for cooling it. But this is so cost efficient. Why are we not using? Have you ever, when you think, have you ever felt your brain heating up? You want to go have a cold shower and come back? No, it doesn't. How efficient the Chat GPT-3 and Einstein is almost close. Now our students in medical college, when we give an assignment, they go to Chat GPT-3, download something and bring answer. Fine, you cheated me now. When a patient comes tomorrow, you go to Chat GPT-3 and find out something, and then can you apply it on the patient? How is your intelligence going to contribute? That has told you something, but how are you going to use it in your life? The classical method of managing a patient is we talk history. I'm pretty sure you people have never come across a doctor who has talked to you, has held your hand. Have they spent 10 minutes talking to you? No. It'll be ಹೇಳಿ ಸ್ಕ್ಯಾನ್ ಮಾಡಿಸ್ಕೊಂಡ್ಬಂದ್ಬಿಡಿ CT. Nothing here. So he wants a CT. Even if it is there, if he is for a small percentage wrong, then you will sue his life. Negligence, didn't treat, didn't care. Calling a obese person obese is malpractice. Body shaming, I know. So we'll come to that also. So then we have examination, then we have a differential diagnosis, and then investigation, imaging. My father's time, there was no imaging. Only urine, motion, blood. No imaging. But this patient survived. We are proof for that. We have survived. But now why this era where patients insist on CT, MRI? Confirmation, cross referrals, and then the following treatment. The underlying thing is the human touch. Now, medical imaging is the process by which physicians evaluate an area of subject's body that is not normally visible. So, I can't see inside the brain, so I need some investigative modality. So, I am asking for certain CT, MR and all those things. Having had that, will it cure the disease? That's a different issue. But for making a diagnosis, we need that. And this is the lexicon of the 21st century. We are not far behind you computer specialists. We also talk about this language, though we don't understand. We talk about such things. Common imaging modalities, I'll be touching a little. I was talking to our friend there who picked me up. Did the previous consultants specialists who spoke here touch upon imaging so I can reduce my time and talk about other things. So he said they touched upon but not in detail. So maybe is it okay for me to repeat these things or skip it? Okay, thank you. I was expecting more answers from you guys. I think, as I told, I having oral diarrhea and you have what? Mental? You were not there when I was telling that. Constipation is a very painful thing, right? You don't, any, one small joke, I don't know, this is on TV and live and all that. Life is beautiful, what do I care? I never know if I just walk out and drop dead on the road there, just on 10 seconds, who knows? So, they said, any asshole can become the boss. Any asshole can become the boss? No, prove it. Okay, the body said, no, our brain is superior because I control all faculties. The heart said, no, I pump blood to all those organs. And the kidney says, I purify. And all. This poor asshole will say, no, I am important. Everyone laughed. What are you going to do? Other than pooping, you don't have anything. Howda, no. He went into, he closed. One day, no problem. Second day, third day, you're leaving health and when your body, all the toxic waste is getting into you, it is so hard. And finally they say, okay, release, you're the boss. You please do something. And there also he has hard stools, cuts and painful bleeding and all those things happening. So any asshole can become the boss. But the purpose, it's a different thing, right? So that's in a lighter vein. So the common imaging modalities which we have is film, the X-ray, digital X-ray. Fluoroscopy is a dynamic thing. X-ray, I think you people have read in physics. You know, this radiation falls on a piece of X-ray film, and wherever it has got exposed, that becomes bright, the rest of the thing is dark. So bone is absorbing all the X-rays, so its shadow will be cast on the film, so that will be white. The rest of the thing where the film, the X-ray is exposed to the radiation, that becomes black, so that's how we find. So fluoroscopy is a dynamic thing. When we do kidney surgeries or heart surgeries, you know, this stenting, heart stenting, right, coronary stenting. When their heart will be beating and they'll be seeing. Of course, that's a CT angio. Fluoroscopy is similar thing. You know, it in a dynamic way you will be seeing. Subtraction angiography is you have one picture and you subtract certain things which you don't want. So you will see only what is needed. Again, it is all thanks to you people. These things have come to computer ultrasound. We have a 2D, 2.5D, 3D, 4D. I think 2D, 3D, all those things we know. What is this 2.5D? It's stacking. In a 2D you have length and breadth, right? One slice. In a 2.5 they have multiple 2D section, and you have in a 3D you have volume. In a 4D you have a dynamic, you can rotate this type, any angle we can see, and the basic principle is, it was sonar, you have read in your 12th physics, ultrasonic waves are put out, it will reflect on certain, it will hit certain objects and reflect back. Whatever is absorbed is gone, whatever is reflected, the probe gets that and it prepares a image out of it. Computed tomography is using X-rays. We call it a gantry. X-ray is one plane. You have an X-ray film, you have the person, you have the producer. When X-rays go through the body, we have the film. In CT, we have 360-degree X-rays, one from here, one from there, all those things. When the film is shot here, I mean the X-ray is shot here, the film is in opposite side. So the entire thing, 360-degree view is taken, and then again the pixels, your computer picks up and it generates an image. It's not the actual thing, but it is a generated thing which we see, and depending upon it has a scale. plus 1000 to minus 1000 and 0. 0 is neutral. So anything which is thicker will become white, when it is water and air it becomes dark. So based on the density of whether it's bone or water or blood, depending upon the density, different scales will be given and we see a image. Magnetic resonance imaging. In computed tomography, we have slice and also volume acquisition, the spiral CT. In 2 minutes, it just goes from head to toe, it just goes like that and the entire picture of the person is occupied. This we do mostly in trauma cases. In accident cases, when the patient comes, when there's no time for, if he's bleeding, having loss of consciousness, we don't have time to examine classically. We'll just roll him into a CT scan, take a volumetric scan, and then while we are treating, we'll get the report as to what are the organs which are damaged. Magnetic resonance imaging. We all have water, hydrogen and all those things in our body. Similar mechanism, we are pushed into a machine where there is a very powerful magnet, 1.5 Tesla, 3 Tesla magnets. When such a magnet, we are lying down inside such a big, huge, powerful magnet, all our protons get aligned, just like military. All the protons will be aligned in one thing. And then they use these radio waves to hit that protons and they start deflecting depending upon the density of their thing, whether it is fat or water, depending upon that they will start moving and the release and energy that happens will be captured and data will be produced, a picture will be produced. For an MR imaging we need to, anyone had an MR of your spine and all those things? You'll have to lie down for half an hour, you had. All sorts of funny noises will be happening. It's already claustrophobic. You're the only person in that room and you're in that small tunnel. Happening. You don't know what's happening. You're there. Suddenly you feel you're in the outer world. People screamed out and come out. This is not possible for me. I'm getting out. They'll run out of that. CT is not like that. Quick in, but you have a radiation here in computer, the CT thing, but no radiation in MRI. Nuclear medicine, you have these radioisotopes, we inject radioisotopes and we capture wherever it concentrates. Suppose thyroid, we give iodine which gets concentrated in the thyroid. So depending upon the amount of concentration which happens in the thyroid, we'll be able to see what are the abnormalities, whether it's a hot spot or a cold spot, and accordingly we do. The PET and MRI are related. SPECT, these are all variation where a radiation material is given, gadolinium or something else is given, and then just to enhance the picture quality. So, the things which I have told you in pictorial mode, because too much of talking without some pictures, it is always relaxing. You know, the human concentration maximum is 40 minutes. After that 40 minutes, you'll have to shift the pressure from one butt to another. You'll have to do that and do this. Otherwise, you'll have bed sores. So, and concentration also will go. So, you need to be flexible. So, I have put some pictures for you to see. Do you see anything compared to these two pictures? You are qualified to become a doctor. I'll give you MBBS degree. This is how MBBS is happening now. Okay, you will be able to tell one thing, pass. It will cost you 1 crore, that's all. Right? You give me 1 crore, you made a diagnosis, take it. So this is the digital thing. In orthopedics, they use this left and right because they want to see whether it is aligned or not. It's like a carpenter's job. Carpenter will come this side, see the side, and then on the orthopedicians also like that. They'll try to fix it, they're not sure, they'll take an x-ray, to the left, to the right, they'll put one nail, and very simple, yaar. Any carpenter can become an orthopedician. Don't tell outsider, they'll all wait for me. Now, ultrasound, I already told you. This is the probe where you have a piezoelectric crystal which generates the ultrasonic waves, and it itself will induce and will receive also, and then you see the picture. And this is mammography where the breast is compressed between two plates and X-ray is given. So to find out early detection of cancer. Earlier I have seen patients in very late stages of cancer. mean, to give you some examples to see that side of life, there was this one lady, she was around 26, 20 years, 8 years old. She had a baby to nurse, 3 months old baby. She developed a pain and pus oozing from her breast. It was quite big and painful. So she went to a doctor. Some doctor who was not knowing how to handle or not make a diagnosis, sadharana, they say yade bavu, because the baby is suckling, didn't suck the milk well, it becomes an infection, so that's what it is. And finally, after 2 to 3 months, this thing is not healing, and she decides to come to me, because I was in the local, this thing, I was the only MBBS doctor. So I also started treating in the same lines because I don't know. And one day my father came to my clinic. So he has this habit on snooping around on his son. Amma also, whenever I'm with someone, she says, 6 gante elli yaar jote idya yen marta ide. Amma used to do. Appa does in a different way. When I'm job and whether I'm doing the right job or not, he comes and snoops. When he snoops, what's that? He said. I said, breast abscess, I'm dressing every day. He came and said, he gave me on my head. All my artificial intelligence evaporated and human intelligence came back. Right. What? That's a cancer, yaar. For the last 3 weeks, people are treating it as an abscess. That's a cancer. What to do? Refer to uncle. Refer to my appa. Refer to care hospital. So he took the case. What? We can't do anything. They removed the breast, and 3 months, patient died. With a 3 months baby she had, if we had treated earlier, it is called mastitis carcinomatosa, very fast growing tumor. So that lady died with when the baby was 6 months old. So can we do something for such patients? Yeah, artificial intelligence. Because when doctors becomes idiots, something which is idiotic becomes super intelligent. If we had only that technique, then we could have saved that life. This will go on, never ending. Every time something happens, we'll blame it. This is the CT gantry which I told you. You will go in there, and within 2 minutes things are done. This is the devil which I told you. Half an hour there you will be screaming and they will not help. Such a powerful magnet, because they don't allow you to have anything magnetic on you. Even oxygen cylinders gets dragged into the system. So there is a warning, you will have to remove. All the patients with this who have gone to a carpenter and all those things, we can't take them because it will just pull the metal out of the body wherever it is, pacemakers and all. So we'll have to be careful on doing MRI on such patients. Nuclear imaging is that the radioisotope we give, and the red will be hot regions and the green will be the cold regions where the lesions are there. Depending upon the concentration, we'll be able to. One of the beauty of that is we can do a lateral construction. Even CT MRI, we can have a different view. We get the picture in one way, but we can manipulate, you can manipulate in different way and give us a better picture, whatever we are seeking for. This is the comparison, and this is video images from within the body. We have this endoscope, although previous investigation were all non-invasive. From outside, you just go stand in front of the system and then it scans you and does all that thing. But here it is, we breach the body. Either from above or below, we put in a scope and see directly, or in laparoscopic, lapra is abdomen, we make a small hole, push in an instrument and then see through the video. So this is one of the the image of the intestines. Earlier we never used to get a chance to say, oh, gastritis, give treatment. But now we can see whether it is gastritis or not. And we have developed the skill of manipulating with the tubes itself, take a biopsy. If there is bleeding, we can inject, we can treat inside. So minimally invasive or non-invasive. And in fact, there are notas where natural orifice we go and do surgeries also. You can remove the appendix, we can remove the gallbladder, there is no scar outside. It's all done through the natural orifices. So the purpose of this imaging is to screen people for early detection. So there are some national projects where every woman after say 30-40 years should get their breast examined. Every man should get his PSA done. So certain, for colonic cancer should have, after 46 or 50 years, should have an endoscopy done to pick up colonic tumors, gastric tumors early. The earlier the detection is, the better the outcome is. If it has already spread to different parts of the body, the outcome is bad. So we'll have to pick it up at the early stage. So that is the purpose of this screening. And screening, humans are not too good at it. So all the equipments are real good on that. Smaller the changes, the more it's impossible to be detected by AI. I don't know how it does, it compares a lot of pictures and similarities. Oh, okay, now this is, at least if it gives us a hint as to which patient is a potential patient. I had one of my, in Coorg we had this tenant who was working in a coffee estate. He always used to complain of his right shoulder pain. He used to hold like that, pain, pain, pain. So what to do, because he's a farmer, he has to take a axe and work on all those plants and all this thing. So every doctor said it is pain, bone pain, muscle pain. So apply some Amritanjan, take some tablets and all this thing. One fine day, 2-3 months of his pain in the shoulder, he passed blood in his motion. One day he goes to the toilet and sees blood coming out of his bottom. Then he goes to a doctor. Then the doctor investigates and finds him to have a cancer of the colon. And the cancer of the colon has metastasized to his right arm, and that is the lesion which he had complaining of pain. So we totally missed out on that. If they had taken an X-ray here and found that metastasis, it's already too late. At least some chemotherapy or hormone therapy and all those things could have been done, could have been saved, but it was too late and he succumbed to it. So a lot of things will happen retrospectively, right? There are a lot of other issues also. It's not just the diagnostic thing or the treatment part. A lot of other things will, if we have time, we can discuss all those things. It's data driven, right? So it all depends upon what data we give, and you will be able to have a program drawn and help us in identifying all these diseases earlier. What are the different types of diseases which we can work on? We'll come to that. To reduce errors and save life. So at the end of the day, none of us have the power to give life. There are many people who can kill life, but to build life, to make life, it is so hard. So if we can preserve life is good. Don't tell it to the army guys, the military, especially American army, they're out to kill. That's all. The only thing they know is how to kill. But the compensation is all these revolutions which are happening is happening there. But with an agenda only will come that. Interaction by gaze, speech, voice and hand gestures. And I already know 2 of your colleagues who are doing on voice and certain biometrics. That's good. I think if I chat with you guys, more will be interested. I think the purpose of this FDP is that. Interact with a totally strange person and see what you can develop and see how you can contribute back to the society. That's the idea. Otherwise, chumma coming and saying some formulas, some program, you do the same old thing. I told you any donkey can do it. How will we be different from the donkey is by contributing back to this society in a healthy way. Right? Whatever we contribute can also be misused. That's another thing. Let's not do the other thing. So this is just revisiting the same thing in a pictorial form. We have your speciality is also there. The second line is artificial intelligence. How it will help in 3D instantiation. I was seeing Sir's CV, whatever brief, he is lot of into AI, hello sir. So I don't know, ನಿಮಗೆ ಏನಾದರೂ ನಾನು ಇವನು ಬೊಗಳೆ ಬಿಡ್ತಾ ಇದ್ದಾನೆ ಅಂತ ಅನ್ನಿಸ್ತಾ ಇದೆಯಾ ಇಲ್ವಾ? ಯಾಕೆಂದರೆ ಹನುಮಂತನ ಥರ ಹೇಳು ಮಗನೇ ಸುಳ್ಳು ಹೇಳ್ತಾ ಇದೆಯಾ? What I was telling is I'm telling all this thing in front of an expert. I know his CV because information is strength, right? So before after I accepted the invitation, I had to do my own work on who he is, who she is, what are the people. That is how doctors work. It's supposed to work. It is not just one point agenda. I mean, all the factors put together. So I think, in spite of all that, if I am wrong, I stand to be corrected by the professor. Knowledge, intelligence, intellect. You can teach this system to be intelligent, but does it have its intellect? Unta? We'll have one more session next year. Kariri ad matadva aita. So depth estimation. In a 2D thing, when we do a laparoscopy, we are seeing a blood vessel, we are seeing a cystic artery. I take my instrument there. It is just like putting a stick in a glass of water. It is looking bent, but in reality it is not bent. So when I do the same thing, I don't know where I have gone, where my scissors is, where my cautery pencil is. So I am thinking cystic duct and cut the hepatic duct. Matter close. My profession is also gone, patient also gone. So that should not happen. There you people help us, right? Now there are beautiful labeling techniques. It will show it to me as a layperson. It will show the cystic duct and this thing CBD in green. It will identify and show it is green. That is red. Baba, don't go there. That is hepatic artery. This is a dangerous triangle. Don't go there. It will tell. Okay. And structural, when I am operating, I'll show you some pictures. Which structure is where? I'll know. Earlier, we relied only on our fingers. My father used to tell me, and I also tell my students, a surgeon like me should have certain features. A lion's heart. Right? When you see blood, oh mama, you do that, it's gone. I've seen various a newly married couple from Chennai traveling to Tirupati, driving their own car behind a lorry. Something jumps from the lorry. It was a metal piece, bolt, iron bolt. Drops. This fellow is seeing that. It comes through the windshield and hits his forehead. He stops, he is conscious, and people bring him to the hospital. I see white pieces all over his face. It is his brain which is coming out, right? The frontal brain. And he died right in front of me. His wife holding his hands. Newly met, they were going to. So I was thinking, where is God? They were going to see God, but God did that. You go to Tirupati, you go to any devasthana, any place you go there, instead of seeing that God, you do this. Isn't it? Why do you do that? God is not there. God is here. You go there because there is some sort of a energy, positive vibes, because all those people who come there are coming with some good intention, not to destroy someone else. So you go to gather that temples were never the places of worship. Even now you should not go and give 1 rupee or 10 rupees and all those things, especially with the new Kanun and all those things. Don't put the money into the dabba. You go there and sit. That the idea is that because it has been energized, you go there to calm your waves, because your waves are going haywire. You go there, just sit. The idea was temples, you go and sit there for some time, but which we don't do. We are so urgent, we are there also. We are that fellow is doing, and he is looking at your pocket. Whether you put 5 rupees, 10 rupees, 100 rupees. If you give 5 rupees, he'll give. If you give 100 rupees, he'll take one prasada and give you. We think it is the Lord giving. No, it's the man who is giving that. So I think all these things is our intellect, intelligence. God has given that, right? God is there. But you know, the karma, prarabdha karma, sanchita karma, all these things has to be entertained. So feature tracking, image restoration, and eventually it will help us. Again, this is purely into your territory. How you people will help us identify certain things in the human body, show it as a picture. Actually, pictures are the one which stays for long. You're quite interactive. Which is the last movie you saw, say 4-5 years back? Last, 4-5 years ago, which movie did you see? Malayalam. Which Malayalam movie? Forget about the name. If you go back to the time, you can see Mohanlal. You can see his girl, you know his story, you can recall his songs. Chutikalchade, Arialo. How many times did you see? Only once. How is that you're remembering that? And yesterday, whatever sir gave you a program, one Python program or whatever program, you're not his student, or whoever. Can you remember that? What did you have for breakfast yesterday? See, what you had yesterday you don't remember. But 5 years back you had this, you saw this movie and you recall it. Why? That's your right brain. That's your left brain is your data brain. If you don't know the pathway, C drive or D drive, that file or this file, you're stuck. And that's what happens in exam. Till you're as long as you're stressed inside the examination, you can't recall. The moment you come out of the examination, oh man, I carry. Happened or not? That's your data brain. If you don't get the path, it is there, but you can't retrieve it. But whereas the visual brain, Paramasugam. So you can be a very interactive also. You can only matter of it, this, that, you know the key concepts, you build the language, that's all. So visual brain. So why did I go there? Yeah, visuals, right. So you people help in capturing images, so that will give us a beautiful picture, all to transfer it to the patient care, right? So various things. AI imaging. Yeah, sure. That is more important. Huh? Oh, good. Coffee is my savior.
Hello. Shall we start the next session?
Welcome back, all of you. How many of you had tea? How many coffee? Okay. Why did you have coffee? Habit? Tea? Who has tasted both coffee and tea? You know? What is the active ingredient in tea? Caffeine. ಏಟ್ ಬೀಳ್ತದೆ. Right. Certain things are common, but common sense is not common. We know there are too much of data, but we are still not analyzing the data. We want some super special data. ಅಂಗೈಯಲ್ಲಿ ಬೆಣ್ಣೆ ಇಟ್ಕೊಂಡು the present day world is like that. Any Tamilians here? Any Tamilians? Illa. Okay. There's a song. Unnai challi kuttamille, ennai challi kuttamille. Maybe Malayalam people. There's no point in blaming you or blaming myself. Ella Deivam seda mayamadi idu. Everything is. We want to see only through a red glass I see, so with a green glass you see. So each one different, but the reality is the same. Right. Coming to imaging, this you're all quite familiar. Now if I had come down without the university's car and all those things, I would have lost. Otherwise I would have put this Google map and then come down. So this you're familiar. How you do that also you're familiar, I think. The same thing we do in medicine. And thanks to you people, you have devised it, you have given it to us. Just like the mapping of the streets and buildings and all those things, like your, what is that thing called? Google Lens, right? You know whether this place is that place or the other place. Similarly, we use the same thing thanks to you people. So this is when you do cancer surgery on the rectum, everything is a mass there. We don't know which is prostate, which is blood vessel, which is. So when we use this thing structure, that blue thing is prostate. So it will say, don't go there, you will get caught. So we'll see that. Here, some blood vessels, where the block is not there, which sector is going. Otherwise earlier it's all blind. We do something, we get something, whether it has helped or not, we don't know. Here, we know something, we do something, again whether it's helping or not, we don't know, but we have spent the money. Heart, I guess everyone has a heart. Ellarum chollanam kallana nenjilanu, halle, kallundo, illa. So everyone has a heart, right? But for so many years, people had ischemic heart disease, had myocardial infarction, and survived. They do that in many TV serials you have seen, and the next moment he is back to normal, right? Here, for cardiologists, they have devised a wicked plan. They say there is a block, they say they will stent, they'll open the flow, but is it going to help? They never tell that. It is presumed people with triple heart disease, I have seen they are surviving without anything, even medication, because the body is so beautifully designed, it has collaterals opening up. When the main channel is, suppose this Mangalore highway is blocked, what will you do? You take a detour? The same thing heart does. The blood vessel does that. The main channel is blocked, and this is not happening just over, suddenly, it is happening over time. So the intelligence there, okay, this thing is getting blocked, let me do an opening. But if I tell that to my patients, how will I bring my wife a beautiful silk saree? How will I bring a Hayabusa to my son? Obviously, I like to say there is a block there, I stented 2 lakhs, 3 lakh. ഇപ്പോഴേ ഒരു ഫോട്ടോ എടുത്തോളൂ, എനിക്കത് അയച്ചു തരുമോ പ്ലീസ്? I am talking like that. None of you took a picture. My wife and my amma will specifically ask, ಫೋಟೋ ಹಿಡ್ದು ಫೋಟೋ ತೆಗ್ದ್ಯಾ? ಯಾವುದಾದ್ರು ಒಂದು ತೆಗೀರಪ್ಪ, ಯಾವುದೋ ಐಫೋನ್ ಇದೆ ಚೆನ್ನಾಗಿ ತೆಗೀರಿ, ಎಲ್ಲರೂ ನಂದರಲ್ಲಿ ಒಂದು ಡಬ್ಬ ಫೋನ್ ತೆಗೆದಿರಿ. ತೆಗೆದಿದ್ರಾ? ಕ್ಲೋಸಪ್ ಶಾಟ್ ಎಲ್ಲಿಯೋ ದೂರದಿಂದ ತೆಗೆದು ಸ್ವಲ್ಪ ಚೆನ್ನಾಗಿ ತೆಗಿಬೇಕು, ಕಲರ್ ಆಗಿ ಬರುವಾಗೆ ತೆಗಿಬೇಕು. ಅಲ್ಲ, ಒಂದೇ ಒಂದು ಪಕ್ಕದಲ್ಲಿ. ಸೊ ನಾನು ಡ್ರಾಮಾ ಮಾಡ್ತಾ ಇರುವಾಗ ತೆಗಿಬೇಕು. ದೇ ವಿಲ್ ನೋ ದಟ್ ಐ ಹ್ಯಾವ್ ಅಟೆಂಡೆಡ್ ಮಂಗಳೂರು ಆ್ಯಂಡ್ ಗೇವ್ ವಿತ್ ಮೈ ಲೆಕ್ಚರ್. ಇಲ್ಲ ಅಂತ ಹೇಳಿದ್ರೆ ಇದು ಪ್ಯಾರಲಲ್ ಪಾತ್ವೇಸ್ ಓಪನ್ ಆಗಿಬಿಡುತ್ತೆ ಅಲ್ಲ. ಥ್ಯಾಂಕ್ ಯು. ಸಾಕು ಒಂದು. ಹಾಂ ಥ್ಯಾಂಕ್ ಯು. ಇದು ಬ್ಯಾಕಪ್ ಪ್ಲ್ಯಾನ್. Right. So, blood vessel, each and every vessel plot where everything will know. But ಅದು ಓಪನ್ ಮಾಡಿದ್ರೆ is it going to help? Yes, for the time being it has helped because I paid 2 lakhs. Right? And then whatever happens, thank you. So, ಮಂಡಿ ನೋವು, 40 years, 50 years old, very slim lady, very slim man, can't walk, painful. So we'll say arthritis. But what actually it is, we'll not be able to see. Now you have investigation, MRI, and it will show what the thickness of the cartilage is. We can put an endoscope into the joint and see whether it is damaged or not. Functional information. Dr. Shashireka's friend is working on MRI, fMRI, functional MRI. So we'll know how certain structures in the body is functioning. So fusion, we can use, interpolate. All this thing is thanks to maths, 0 and 1. Right? We are playing with mathematics all this time. Thanks to you. That's what I was just talking with your head of the department. Rather than the technology coming from your side, our doctors should embrace the technology and we approach you, look, I have a problem like this, can you help out? It should be a tool. But unfortunately, when you do it, it is a replacement for the doctor. Many of the patients, they ask for an MRI, ask for a CT scan. The IT-BT people, hell, they'll come with a diagnosis. I want biopsy done. I want cholecystectomy done. Are Baba, whether it is to be done or not, leave the choice to me. But I will not lose that choice because the moment you come with that diagnosis, I'll say it is 2 lakhs. Normally I charge 50,000, but because you have come with a diagnosis, made my life easier, but I'm going to charge you 2 lakhs. So, it's conventional surgery. This is the brain, and I removed the part of the brain, not me. Of course, as a general surgeon, when I was in the Caribbean islands, from head to foot I have operated. No legal issues, no medical negligence, nothing, because it's such a small country and Indians are so skilled. The Westerners, again, it's all by protocol. It is, you have this array and loops, if yes, you go this, if no, you go there, again, you go into a loop, they'll be going like that. A little out there, they are stuck. But Indians are not like that, very innovative. So I didn't know about this thing. So I started operating, and every organ in the body I have operated. But I can't do the same thing now in India. In my land I can't do because I'm afraid of a case being filed on me. What is your capacity? What is your speciality and all those things? So here conventional surgery we used to do this. Now image guided. I take off the brain separately from the skull, from all the structures. I know what's happening there before I go there. I know where the tumor is at 5 centimeter. I have a coordinate XYZ. Go there, identify there, and come out. This advantage is thanks to your computers and other things. Yeah. Yeah. You are ahead of my presentation. I'll come there. I have that. at least finally after 1.5 years, after hours, after one bonda and coffee or tea? Tea. Tea has some brains have started stimulating now. I would appreciate that everyone's brain starts tingling and give me some data. I want data. I'm starved of data. So augmented reality, all these things I think I need not explain to you, but these things definitely will help us. As I told you, as a tool. If you are thinking to replace me, I think the choice is yours. I think the society has to decide on all those things. So here you have this is how you do, right? I think most of you who are already into this, you know that. You have an input, you label it something, and then you have your AMI, you start, I was very, how do you teach this machine learning? I believe you start writing question and answers, about 12,500 questions, interview people, sort out, then feed that to the system. And then second step, you have another 32,000 questions or something like that. Third step, you have another. Finally, that becomes intelligent. Is that the way it works? So, right. Yeah. Yeah, data, you're right, yeah. But initially, somewhere where you have to start, it is the intelligence in you which has started that, and now we are surrendering it to the artificial intelligence, right? Again, this is one gallbladder surgery which we are trying to do. It identifies what instrument, whether it's a harmonic scalpel or it's an electrocautery or it's a forceps or a Mayos, everything, and the different structure gets colored differently. It's again data. When we have data but we don't know how to use, we give you the data, you don't know how to apply it back on us. So it is probably better we both sit together, plan it out and then do it. But that marriage, eventually this thing will happen, I think. Now universities are trying to integrate all sorts of things. So eventually there may be a course where you study MBBS and get out as a computer science engineer. So that's also a possibility. Nothing is impossible. This is one diabetic foot. All those things which I was telling was something different. This is my area. When there's an ulcer, diabetic patients, some gangrene and ulcer and all those things, I don't know whether it is improving or not improving. Now just a picture with your smartphone, I'll be able to see whether it is improving, deteriorating, what's the size of the wound, what's the depth of the wound. Everything I will be able to assess there. And we have certain infrared images, heat scans. Thanks to you people. Again, when the blood flow is good, we have that red thing coming up. If it is green or blue, blood supply is down. So how to improve it? Now, when the blood is low, that is the reason for the ulcers to come up. Is there a way we can improve the? So if you give me this data, I'll try to improve the blood circulation. Once the blood circulation increases, then automatically the wound heals. Now, this is actually histopathology, but I used as a combined thing. Now, there are certain situations where we do a biopsy. We take a small tissue out of the body and see whether it is cancer or non-cancer. Now, a pathologist should, suppose I give a big stomach or a liver, it's a monotonous process. They have to slice it, take each and every bit, see under the microscope. After a certain level, there is human fatigue. They'll not be able to, by run of the mill, as I told you, the doctor is talking to you, mobile, yes, they'll also do the same thing. When suddenly out of the blue they see, this is a malignant cell, they'll give a report. They don't have the patient. Now, the same thing, artificial intelligence. They have scanned so many pictures, so it will be able to tell you whether it is a malignant tissue or a non-malignant tissue. It can also tell whether there is an infection. As I told you earlier, the microbiological AI conference coming up in Mysore, they'll be able to, now we'll have to take a culture, send it for 48, 72 hours. Till then, what to do? People are using antibiotics left and right. We don't know which antibiotic is effective on which microbiological agent. So artificial intelligence, you just put it into the system, you have your report coming up. So we need not wait for 3 days before we start treatment. It may be too late. Now, certain infections also, whether there is an infection or not, we have the CRP levels and total count levels to say indirectly there is some infection. But where is the infection? But here, we just scan, we give some contrast material, wherever it is enhancing, that is the area which is having this infection. And we start antibiotic and start following it up. Again, if it is resolving or not. Before these intelligent pictures, we are not able to see. We'll have to wait for the clinical progress. A patient with fever, pain, and all this toxicity, we give an antibiotic. We'll have to wait for 24 to 48 hours to see whether it's improving or not. But now with this imaging technique, we'll know whether the patient we are on the right track or we have missed something. This is again an MRI using machine learning. They have two groups, which is osteoarthritis. Osteoarthritis is usually the joints which gets damaged, and best experts can't say, but your artificial intelligence, it will pick up and in advance, 3 years, well in advance, it can predict whether this patient is going for. So we can take precautions well in advance rather than after the thing comes. AV holography. Here, before we go, we have a model, and we can try our surgical thing, whether we'll be approachable or not, and all those things we can decide before going inside. A trial run, sort of a thing. Of course, medical robotics, beautiful thing. It is not that human beings are disposed here. Man has to put in a laparoscope, he has to put in the channel, only then we can come and operate. The beauty is, where we are doing certain surgeries which take 6 to 8 hours. I was telling you, lion's heart, somewhere I stopped. Lion's heart and a eagle's eye. Eagle's eye, when the girl is yawning, I caught her yawning, and so we should be observant. When there's a blood vessel spurting, I'm concentrating here, there's a blood vessel spurting there, immediately I should be able to go and catch off the blood vessel and ligate it. And I should have a lady's finger. I don't know how many ladies will agree that I have a lady's finger. The idea is lady's finger is slender and it should be delicate. You know, how you caress a baby, take a baby, you do, right? The same thing I'll have to play with the blood vessels in the intestine. If if I show, the intestine will come to my hand. So you'll have to be very gentle in dissecting the planes. I'll feel, I'll know it, I'm in the right plane. But if I use the robotics, I'll not know. Of course, they have found out certain gadgets also. I'll not be totally, I'm blind, only my hand is inside, but there I'll be playing around with the same plane. And then you should see one of those procedures where I do this lipoma. Totally blind, small incision, I put my finger, I'll be talking with my nurse, if she is beautiful, otherwise I turn this side. Right? I'll be talking to her, and then my fingers will be playing inside, and then pop, the entire lipoma pops out. So I know where the plane is. Right? But whether I can do the same thing with the robotics. But the advantage of robotic is when long surgery, 7 hours, 8 hours and all this, I can go have my bonda bhaji and then come back and start where I have done. That is not possible, because part of the thing which I told you, lion's heart, eagle's eyes, lady's finger, and the fourth one is camel's bladder. Because I can't say, ma'am, excuse me, I'll go and come. I can't. Because when I go there, I'll remove my gloves, my apron, my everything. Again, I'll have to come, scrub, start, redo. So instead of that, we'll be knowing, but we'll have to do. But over time, machine learning, human learning, we know how to subdue certain desires and all those things. We try to go ahead. That is a human touch. I don't know whether these machines can do that. So this same, just because I had to talk for 3 hours, I had more pictures. This thing, pre-operative assessment, like before a knee replacement and all those things, what's the size of the gadget, so the instrument which I have to use. We can do all these things, trial run before and then do it. Optical video thing, how the sensation, feedbacks and all those things, all these things said and done, the good part of it. I think this is again your territory. I should not be delving much on this. I'll just say that there's something called brittle models may limit. There's a plant and there is some sort of a output coming. They introduce some medicine foil there, aluminum foil, and it is showing something else. They just pushed it and pulled it out. This is a video capture which I did. And now when both are there, we have a different diagnosis. So how will we trust that? So who is responsible for this? So I think the terminology there, brittle models, you are better. I'm just trying to say how you can rectify or identify these things and help in improving these sort of things. The ground truth level. Now you have an X-ray there is some lesion there. So what is that lesion? We as doctors, we ask the patient how long it is there, how it happened, what is the progress, what everything we'll be able to discern, and then of course in your computer model also we'll give it the data, but what is the finding? Is it consolidation, opacity, infiltrate, collapse, or scarring? It can give any of these options. If it is giving any of these options, then why should I have this thing? Only thing is, this is fit for American system, where they work only for so many things. India is really, I think we should be really blessed. We say doctors are bad, doctors are not good, systems is bad and all that. At least if you have an emergency, you get treated on a priority basis within an hour or so. There in the UK or US, you'll have to, unless it is a dying patient, dying emergency, and that broker, so-called there's a practitioner, medical practitioner refers you to the institution, you will not have access to medicine. Even a cough, cold, they'll do a culture, viral, wait for the report, only then they start treatment. Our guys are not like that. Okay, you get the treatment. So for that system, they need this, because after certain things, it's a Thursday night or a Friday night, he will not see you. His life is more important than yours. But here, you say, I'll give you 10,000 rupees more, can you do it? He'll stay with you forever there. He'll come to your house, pick you, he'll do the operation with the kitchen utensil, whatever, he'll do that. That's, I mean, I'm just making fun of it, but in reality, this is what Indian doctors are capable of doing. But all these things are meant for the Western thing, because the scanning is that 2 days later, someone radiologist will see that report. Till that, it will not be available. But for our setting, it's not like that. We order a scan, we go there, discuss with the radiologist, and half an hour, 45 minutes, we have the report, we start treatment. It's not available there. And I told you about the findings. Now, after the findings, what is the diagnosis? And eventually, after the diagnosis, the human has to treat. Why go through all this cycle? If it's a remote thing, suppose I am in Mysore and my patient is in a very tiny remote village in Coorg. They have access for X-ray, but no one to interpret that. In such things, it will help. They will send the image, we will review and get back to the treating doctor. Everything has its own brittle model again. If there is a foreign body, if there is a bone, if there is a movement artifact, how will we? Of course, once you know it, it's always like that. It's something like magic. As long as it is hidden from you, wow, man, it's a magic. The moment they tell you the secret, it's not magic anymore. Oh, that's all. The same thing happens. Amongst all these things, what is the optimistic thing about your artificial intelligence, machine learning, computer vision, and all those things? Can we apply this technique to other diseases? Possibly. Alzheimer's, autism, schizophrenia. Oi, 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 oi. My God, I saw the entire universe there. That's a secret between her and me. So, earlier people used to live for 30 years, 40 years. Now we are living 80, 100. Along with that, there is an extra package also coming. Disease, dementia and all that. Can we catch this thing earlier? Yes, you people can help us out, identify certain things. If so, can we halt them? Once we identify, can we halt them? That's the next thing. There's some, I think you people are doing a lot of things. There is an ECG where age, sex, ejection fraction, how much the blood pumps, and whether there's anemia, diabetes mellitus, hyperthyroidism, kidney disease, based on ECG only, machine learning. Humans, we can say whether it's a heart attack or not. We can tell whether it's rate or not, if there's a conduction abnormality or not. But I believe there's an algorithm for this ECG where all these parameters are being given. We have retinal image. I was talking to our biometrics. Is there a possibility of changer? Yeah. Here, just with a retinal image, they are able to diagnose diabetes mellitus, hypertension, liver, kidney, heart calcium score, Alzheimer's, heart stroke, heart attack, stroke, hyperlipidemia, and Parkinson's. Just one screening. At present, we have to really spend millions of rupees to identify, screen all these people. But Artificial intelligence has come up with just one retinal scan. You just pay for that and get what next? Again, you have to go to a doctor. You have a diagnosis, but whether I'll be able to treat the patient based on this diagnosis, we are lost. The pessimistic thing, bank server always down. It has happened to me many a times. Has it happened to you people? When you put ATM not recognized, try again, no insufficient funds. I have enough funds, yeah, but you're helpless. The same thing happens in AI. I go in, I want to cut the cystic duct. It says, no, you can't cut the cystic duct. Try after some time. I wait for some time, I try again. No, it says, no, access denied. What then? My instruments are all there and it has denied access to me. Is it possible? It's definitely possible. Because banking transaction, I know for the last 20-25 years, this debit card, credit cards are there. Even today, yesterday when I went to Canara Bank, it says, access denied. Yeah, I can't draw my money. Next counter I go, I get my money, but not this counter. Why? Can this happen? Yes, it can happen. So should I take a risk in believing this technology and going and trying it out on my patients? GPS of my house location and route. Whenever I book an auto for my wife, it always shows my neighbor. So I really don't understand. She has labeled it, my house number, everything, but it will always go to the neighbors. And the route which I want to take, it does not show. Even if I ask for alternate route, it says the main road, you'll have to go like this. So somehow it will come back to this route only. Even if I change, it will turn like that, and then again it will come to the same thing. Can this happen in my surgery also? Possible. What next? If that happens? Equipment, okay, you can switch off the plug. But can I do after I anesthetize the patient, enter the patient? Can I afford to do this? Medicine is not exact science, I told you. Labels, bias, abnormal anatomy, deep fake, voice scam, synthetic data, these are terms which you are very well aware. Suppose my college student, I was just talking, if I fall sick, I will never go to my students because I know them very well, better than you. I don't want. So it's better I suffer rather than go. If you give this film or image to, please don't tell that Ponnappa told outside, otherwise, please don't use my name. This is just for educational purpose. Right. Oh, live. Right. Labels. Someone labels it wrong. He thinks to his best knowledge that that is that and labeled wrong. What happens to your data? What happens when you use that sort of a algorithm to find out is there a possibility? Yes, there is a possibility. Bias. Lot of bias will be there. I have a preference for this thing. I have, suppose treatment, angiography versus open surgery, angioplasty versus open surgery. Should I, the medical cardiologist will say, no, we'll go for an angioplasty. But a surgical fellow will say, no, we'll go for an open heart. Now, accordingly, we are already biased. When you start labeling, we'll go with that bias only. Why should I favor the other person? I'll favor always myself. So when this thing happens, your data itself is corrupted. The other deep fakes. I saw the other day that famous Tom Cruise doing some sort of a magic and all those things. It was a total deep fake video. Someone else has done that, but it is, you cannot identify that it is not Tom Cruise. It is all features of Tom Cruise, but it is not. So the same thing, I have a liver being seen on the left side of the body, liver is on the right side. Now it is showing me on the left. Should I trust it or not? What happens? What if it has been, now you have your voice cam? I don't know, again, earlier I was telling, artificial intelligence, super conscious telling me to go talk about artificial intelligence. I have my Gmail, Canara Bank sends me a deep fake voice cam. Someone known to you will be talking and they'll tell about all these things and hand over your passwords and all those things. Is it possible? The same thing in surgery also. Someone who doesn't, he is a rival. There is a thing and I do the wrong thing on my patient and I get caught. Is it possible? Definitely. This is Kali Yuga. So we are not interested in doing good. It's not Satyayuga anymore. So is it possible? And eventually, how do you order food? Swiggy, Zomato. You can also Swiggy a doctor. Doctor, Swiggy, he'll come on his scooter and he'll do things and go back. Is this all possible? I'm pretty sure it's possible. It's a competitive world. It's an economically driven world. If you go to hospital, you have seen that. I'm pretty sure you people also have, Anna, hotte novide one tablet kodi. Anna, fever ide, give me a dolo. Have you done that? Yes. Instead of, if you go to a doctor, he'll charge you 300 just by watching his mobile and say, take a dolo. So why go there, 300 rupees, 30 paisa dolo? Do it here. So is it possible? I don't know, like hypothetically speaking, all those things. Massive bleeding, wrong tissue plane, emergency. When you label it wrong, or you're, well, whether these investigations, because when there's a bleeding, everything, your camera is not there anymore. You don't see anything. Now, I have gone in. I'm using this technology. There's bleeding. What should I do? Advantages of AI medicine, again, optimistic. This is apart from the imaging part of it. I believe there's a 10-second voice clip of patients, of persons, and they'll be able to tell you whether the person's voice clip is diabetic or not. Really baffling. My voice, what is it has a relation with diabetes? 10-second clip can tell diabetes or not. Where is need for doctors then? Right? Gaze tracking is for us doctors, when we are operating surgery, doing certain thing, we'll be observing the video screen and start manipulating here. We'll be looking there, and if your software can gather that gaze thing, yes, it will definitely help us in which plane we are going, where am I going, it will help us. Robotic drug dispensing and all the things, which will be standing CT. Now we have advanced, I believe in Japan there is a very ultra-modern house. Instead of going into the tunnel, because not all patients will be able to lie down and get into such tight spaces on a wheelchair, how to bring them manual. So wherever they are, the gantry itself will move on top of us and take the pictures. Yeah, I think those are the things which are really advantageous. Bed sensors for monitoring. Instead of the too many, they have mats under the cot. It will sense all those blood parameters, vitals and all those things and tell you. And one of my teachers from Chennai, he has developed a mat. He says 101 parameters can be done, nanotechnology and all those things. Only when we know that, whether it is for the sake of paper, they would have done that. Whether it is really useful or not, only when it comes into the mainstream, we'll be able to appreciate the pros and cons. Robotic procedure, cancer detection, I already told you, breast cancer surgery. When we do a sample, there's a lymph node in the axilla. Now whether I should take the full breast off and go to the axilla, or take a portion of the breast off and just leave the axilla node, how to do it. And in such cases, probably we do a sampling technique. We sample it out and send it for a histopathology and see whether it is involved or not. Then if it is involved, we do. Otherwise, should we go for an axillary clearance? All these things, your machine algorithms can help us out, whether in any given patient, because we have a lot of difficulties in convincing the patient to go for this surgery or that surgery. When they ask why, many a times we are lost. I have done that, and many a times our colleagues also do that. One nimsha bande, we'll go to the next room, open our Google search, because we need the hardcore data. We don't have the published article with us when the patient is there. So we go by immediately to the data, check it out and come back and okay, this is fine. In those sort of situation, if patients also know that we are also humans, we are also going to commit mistake, we are also don't have that sort of a brain to remember all those medical data, then otherwise people may say, avanigeenu gotte illa, computer nodibittu treatment ಮಾಡ್ತಾನೆ. That's also a possibility. So how to balance all those things? Now advantages coming, going to next, exascale, the frontier supercomputer which I told is an exascale computer, it seems. Supercomputer. Now they're thinking of Yoto, Zeta and all those things. Where are we going? Where will we get the data to feed such monsters? Maybe there is a lot of data, that is why we are doing all these things. These sort of exascale and zeta scale will help us in personalizing the treatment for patients. Suppose a patient walks into my room. age, sex, his genetic makeup I know, his genomic status I know, his microbiome status I know, his proteomic status I know. Then I can put into the computer and see what treatment, appropriate treatment, whether I should go for genetic therapy, whether I should do this therapy or that therapy, manipulate. All those things, maybe even, that is so much of data, right? Genomic sequence itself is so much like that. When such sort of supercomputers come, then it will probably help us in identifying personalized, because all of us are wearing a shirt, suit, pant, chudidars and all those things. One size does not fit all, but actual medicine is one size fit all. If appendicectomy has to do appendicectomy, we will do appendicectomy. Whether can we manage without appendicectomy, whether alternatives are available, it's not there. But if you give us that data and get processed, maybe it will help us to do a personalized treatment. Quantum computing, again, now as if exascale and zeta scale is not enough, you go to quantum computing. I believe you use qubits rather than bits. Bits ಅರ್ಥ ಆಗಿಲ್ಲ, ಇನ್ನು qubits ನಮಗೆಲ್ಲ ಅರ್ಥ ಆಗುತ್ತೆ, ನಿಮಗೆ ಅರ್ಥ ಆಗಬೇಕಷ್ಟೇ. And 5 nanometer to 1 nanometer chip size. It's not size, I believe. It's not actually the size. They're trying to bring down the chip size and increase its capacity. All those things probably will help. The bulk and all those things will reduce. Informed decision before a disease strikes, this I told you. Lifespan versus health span. How many of us would like to live 200 years? Raise your hands. None? Only one. One more shot. How many of you would love to live 200 years? None. I'll give a small twist in the question. How many of you would like to have a healthy life as you are for another 200 years? Yes, obviously, isn't it? So we want to have, instead of having a lifespan, I don't know whether all these diagnostic things and therapeutic involvement will help us live a life. But what if I'm bedridden? I'm alive. Wow, great. I'm seeing like Stephen Hawking. Well, someone was there to fund him. Someone was there to help him. They had a synthesizer. They did so much of research and gave him a beautiful life till he exited this world. But is that opportunity available for all of us? No. So it is better to have a healthy life rather than a miserable long life. Can machine handle certain things? Now, it is, though it's an imaging module which we are discussing now, at the end of the day, whether this imaging model is going to help in my clinical practice or not will be the thing, right? So I'll give you 3 examples, my own personal example. Huge spleen. Spleen is one organ inside the abdomen. It was to be operated. This happened in the West Indies. It was about 6 kilos, 7 kilos spleen. The lady was so thin, she walks into the OPD of all doctors in that island and says, please remove it, please remove it. I can't, it's so heavy, I can't turn, I can't sleep, I can't lie down, I can't walk properly, it is so heavy, please help me, I can't even eat. It's huge. So, option is to remove it, but who dares to remove? No one, because she might die on table, or after removing it she might die, we don't know. Life is not in our hands. We can do a procedure, that's all. But that lady went to the health ministry, because that's such a small island. She said, I will not hold the institution or the doctor responsible for it. Please help me get out of the misery. I am authorizing this doctor to remove my spleen. Indian doctors are called coolie doctors. She wrote, I am a coolie. I had to observe, take it, because coolie doctor, I want this coolie doctor to do it. I said, fine. I removed it. And the following week she comes and said, Doc, you're such a darpok, you're so afraid to do this. Look, I'm fine. Thank you, Doc. Thank you, Doc. She brought me some home cooked food and thank you, Doc. She blessed me and went. I felt so relieved. Great. Another splenectomy is a 3-gram hemoglobin, accident, and eventually patient had a kidney injury, had an intestinal injury also. Now, when we went in, there's a lot of blood. All the blood has leaked out. When we went in, we saw the spleen is damaged and the rest of the structure is also damaged. We could handle all the thing once the kidney was also torn in 2 places. So I had to remove the kidney out. So when that happens, whether our these gadgets and all those things will be able to help us. If so, what is time? There are times when people have operated for gallbladder removal in 45 minutes, 1 hour. But your robotic surgery, laparoscopic, how long will it take? How long will the physiological parameters help? Well, everything has an advancement. This also will have an advancement, but we'll have to weigh all those things. Another splenectomy. One gastrointestinal surgeon started operating. It was also a huge spleen. He's playing around with it for 1.5, 2 hours. He's not able to. It's bleeding, bleeding, bleeding. So finally he told the nurse, or the nurse told the doctor, "Sir, can we call Dr. Ponnappa?" Hey, nille. After 1 hour, 2 hours, he said, "Okay, call him." I went. So I said, "Can I do it?" Yeah, please, sir. I just put my hand, I found where the splenic artery is, I clamped it, delivered the pancreas, the spleen, ligated it and handed over. Mugito. Hardly 2 minutes. But those people lack the training, which I underwent. Because they are all laparoscopic surgeons, very sophisticated procedures, very slow, catching hold of RBCs and all. But we didn't work like that, because we were racing against time. To procure one bottle of blood, it will take ages. Cross match, get, where will you have time? So the best thing is, you know where the artery is, you go hold the artery, rest is, we already stopped the bleeding, deliver the baby out, clamp it, matter close. But over time, if we lose this sort of skill, if all artificial intelligence and imaging techniques and robotics are being used, if humans lose this skill, what happens to the patient on table? If some small glitch happens, are doctors skilled enough to handle such sort of situation? This may not be happening right now. Foresee another 15, 20 years, when all surgeons are trained in this sort of techniques and they don't have hands-on skills. So what then? Can we teach human values to AI? Yes, you can put in the knowledge, but whether it will apply or not. AI should be tools in the doctor's hand, not the otherwise. Is this the business of conspiracy of disease or health? I was telling you about that obese and all those things. You eat chicken biryani, chicken manchuri, chatti pattiri, gobi manchuri, all these things you eat without caring for your health. And then when you come with a disease, you come to the doctor and say, "Treat me, sir. I have this problem." You didn't take care of yourself. Am I a contractor for you, your health care? Don't eat sweet, you eat sweet. Restrict, go for starvation, you don't do it. You do all the things which you're not supposed to do, and when you contract the disease, you come to the doctor and say, "Do something." How is that possible? Yes, artificial intelligence can do it, but is that the way which we want it? Again, death, with all this imaging, we are told life-saving, life-prolonging and all those things. Can we cheat death? We don't know after 20, I don't know what is death. I've seen right in front of, sitting in front of the patient die. But I don't know where the life just ebbed off. So, in spite of doing all this thing, can we prevent death? Can we improve the quality of life? At least the quality of death. There are patients in ventilator for 3 weeks and then they die. Should we do that? Beka. No, they have 10 lakhs FD. They bring all the 10 lakhs to and give for the hospital to save the patient. All the 10 lakh is spent and the patient dies. If that money was there, probably for the children or grandchildren, something would have been useful for them to live a quality life. Now all those money has come here and gone there. Is it worth doing? I'm not talking like I already told you, I'm an expert, but not on the domain of computer. But I'm talking to computer specialists, artificial intelligence specialists, because I'm giving a human touch, not just as a doctor thing. I'm not telling about how a doctor runs his business, but just as a human being, but also a doctor. See certain things from a different perspective. The standard thing everyone can give you, but I'm just trying to see, I don't know whether I'm successful or not, I don't know. I'm just trying to give the other perspective. So the earlier was Shushruta surgery. people used to hold the patient and operate. We don't do that anymore. We have this sort of OT, and I'm very happy to do OT in this sort of thing. AC, bright light, all instruments, all help and all those things. But with you people coming in, all the images, all the data, all the past, all the thing, everything for me, I would definitely love to work in this OT, where the imaging sequence, your 3D imaging, all guiding, everything is there, and I sit in the background and watch all those things. This will be the OT of my choice. But will it be there? Already certain things are there, but whether we'll be able to use it in all surgical thing. But definitely I would love to. That means I love maths. I love computer science. I love artificial intelligence. But to a certain extent, always love is like that, like when you are loving a girl or a boy, you go for a movie, you go for on a ride, a breeze in your hairs and hugging and all those things. After marriage, what to do? Ade mukha, ade belagage ide mukha nodbeku. When you are loving, it's not like that. You go to a different house. Next day morning, you are so excited to meet that partner and have fun. But when you get married, ಅದು ಮದುವೆ ಆಗಿಬಿಟ್ರೆ ಫಸ್ಟ್ ಮಧು ಆಮೇಲೆ ಬರೀ ವ್ಯಾ ಆ ಮಧು ಎಷ್ಟು ದಿವಸ ಇರುತ್ತೋ ಗೊತ್ತಿಲ್ಲ. So the same thing we'll go through this phenomenon. So initially it's all exciting, but where will it lead us? Next, ethical and legal issues. ಮುಗಿಸ್ಬೋಣ, ಇದು ಟೈಮ್ ಇದೆಯಾ? 12:35 ಆಗೋಯ್ತು. ಓಹೋ, we'll wind up here. Okay, another I think 6 to 8 slides ಇದೆ ಅಂತ ಕಾಣಿಸ್ತದೆ. I'll just trying to ethics and legal issues, like standard. We need an informed consent. We leave the choice for the patient. The patient has to decide. Autonomy, benefit. It should help the patient. Non-malfeasance. I should not do anything with a malintention, and it should be justice applicable across the board. Whether when we use this sort of technology, whether it is safe and transparent, how the data was built up, we don't know. Whether we can have certain process where we have the transparent, when the coding is written, this is how it has been done, it has been reaffirmed by someone else. And algorithmic fairness, all this term, I will not go in detail because you know better. Data privacy, whether government and tomorrow I have all the data of my patient, but I was just talking with one of your experts here, will the institution give all the data to you to do the research? If the institution has all the data, is someone going to breach that data and take then what happens to my patient-doctor relationship? I have agreed on certain terms, I have the data. Government can say, I want it. Aadhaar card, everyone is Aadhaar card now. Aadhaar card and take the data. Well, whether I'll be accountable or not. Now, this is a big phenomenon which I will not be able to. Black box, I believe artificial intelligence has this black box sort of a thing. It makes a decision, but how it arrives to that decision, it's very difficult to predict, I suppose. Now, that's why they have come out with some mechanistic interpretability, where they have an artificial intelligence on an artificial intelligence to see how that artificial intelligence works. So, at least there we have a control on the black box. And we have this evaluation of standards, where when the artificial intelligence shows some misalignment, it's doing something dangerous or going haywire, can we detect it early and try to intervene? There was this MIT ethics experiment where there is a train with 2,000 people, and on the track there were a couple of students walking. Now, you have a gate, the control to change the track. What will you do? I have given that track to the change the thing to you. Whom will you save? The children or the train? What would you do? If I ask generally, we will not be able to tell. Umachi, you will save the children or you will save the train? 6. Train, it's a passenger loaded train, 2,000 people there in the train. Saving more. So you'll sacrifice the future. 6 children who are going to be... It's so difficult for us to decide. How can the artificial intelligence decide for us? When we are having this sort of trouble, ethical issues, whether the system can be able to, it's just coding. Will it be having that sort of intelligence? They say preference will be given to saving 2,000 lives rather than 6 lives, right? So it's again ethical issue. Different philosophies will speak about different things, but whether the machines will be able to do sort of that sort of thing. AI system failing unexpected drastically. I told you, money not available, your card not working. If that happens, what will you do? If instruments are smart, what happens to the human skill? I told you about this splenectomy. At least that fellow called me and we were able to, I'm not trying to boast here. This has happened to other consultants also. People who are trained, especially in laparoscopic only, they'll not be able to handle open. They'll find it difficulty. They'll have, so in that sort of situation, what should we do? Models trained on data based on biased human decision, we already did. Healthcare technologists and or the equipment, who will be held responsible? The government say, we have given this technology, it is you who have decided to employ that, so you are medically negligent, you are responsible. Why should I take care? Someone else's baby, I get blamed for it. Why should I do it? What about a trust in doctors? People come with their diagnoses with the Google, ChatGPT, Palm 2 and all those things. So what am I doing here? Just dispense the treatment. What if the treatment fails based on that diagnosis? Will I be responsible or Palm 2 or GPT held responsible? So before we apply all these things, we should think about the other alternatives also. Our friend was asking about chips and all those things. There was this bionic eye. A person was blind and they used a bionic eye to see him, and eventually the company winded out. Now what happens to the bionic eye implanted, the chip and all those things? They don't have batteries for that. Now who is responsible? He came, he made his money, he left. Vici Vini Vida or something, Vini Vici Vida, something like that. So what happens to the patient now? Who is responsible? The doctor or the person who supplied the bionic chip? Whether this will stay long, how will they, where will they? Yeah, of course, neurosurgery, they have all these things. They'll implant. For Parkinson's, they have used electrical stimulation, and the person who is vibrating to drink water is so stabilized he can drink water and so he can walk straight. All these things help. But what if there's another version? I have a model of phone which is incompatible with the new software. What happens then? Should we continue the old software and continue to cater for that, or what else to do? Tampering images by hackers. Stop sign analogy, I think you people are very familiar. There was this car, auto-driving car, you know about that, na? Yeah, they just put some tapes on that red parking, this thing, and stop sign, and this gets confused. Just tapes, nothing more, no the coding change or nothing, just tapes they put on the thing, and it went haywire. So what such situations happens? Ransomware. Data poisoning, software rot, recent ChatGPT glitches. Recently there was ChatGPT the glitches, it was talking nonsense. What happens in that sort of a situation? Who is liable? Whether a doctor liable, or the technician available, or the coder liable, or the instrument producer liable? Who is liable? It's very difficult. Theoretically, to speak, as I told, in AC room, armchair, it is nice to talk. When it comes to implication, I may be wrong, let me be proved wrong, but these are certain things which I have collated from literature. Everything is protocol, protocol, protocol. One beautiful example of one of my friend who was working in Chennai, there were some floods in Chennai. The protocol said, get into a higher location when there is floods. The software guys, they stood on a desktop and were waiting, but water was only knee deep. These rescuers went there, what are you doing? Sir, protocol, get to a higher range, so we are on a higher situation. True? According to this, you can walk now. Sir, it's not written. So protocol. What happens if that sort of a situation crops up? AI and robot rights. Sophia, Stephen Hawking, you know, the Sophia has a legal right. So what happens like tomorrow when such systems get their legal rights? Whether they will be able to autonomously function and responsible for their active actions, or the doctor or the system will be responsible. Inherent healing of the body, colonic polyps. There was this endoscopy test where it detected most of the colonic polyps. Colonic polyps are future cancer possibilities are there. So an endoscopist who missed the colonic polyps was detected by the AI. It could detect. But there's a human healing system also. Not all polyps will go to malignancy. So just because you have found a polyp, what is the treatment? Should I go for a surgery or not surgery? Should I wait for the thing to become cancer or not? If we have already diagnosed, then why you didn't treat it? How to answer these questions? Empathy is definitely will not be available with the equipment. Maybe it will speak, but that feeling. Social variable, are we ready? Government versus private hospital. I told you we have the structures. Government provides everything, but to run a hospital, they'll have to pay for license, they'll have to pay taxes for water, environmental pollution, all sorts of things. Nothing is subsidized to the hospital. But when final bill comes, hey, so much bill they have charged. Now who is responsible? The government. Eventually 50 to 60% of the revenue is going to the government. And those are the people blaming the private hospital that you are charging more. If they can provide all these things free, we can also offer services free. So again, as technology, all these AI, does it come cheap? It always is a business module. It has to be invested. It has to be done on a mechanical model, applicable model. When that comes, can you give it free? Who has to give free? It has to be charged on the patient. If a simple procedure is being manipulated by the artificial intelligence, what happens to the cost? Who will, in Western situation, you have the insurance. How many of our people have insurance? Again, should we apply in our situation? I told you whether clinician should be accountable for liability, culpability, and the output of AIS. If adaptive algorithms can change every minute, because your artificial intelligence is learning from every data it gets. If it is dynamically changing every time it gets new data, now which part of the system should I be responsible for? Or which part of the data will be the artificial intelligence responsible for? Diabetic foot, many people lose their legs. Maybe I have operated on I removed about 500, 600 legs so far in my life, below knee, above knee. It's very easy to say like, oh, you have to save the legs and all those things. But a small ulcer, for a diabetic patient, what is his actual expenses? But if the old man is or the lady is alone, who buys medicine for them? Who will bring them? Who will get, if there is an ulcer, who will get them to get it dressed every day? One dressing will charge 500 rupees, 300 to 500 rupees per day. Can they afford to have that sort of treatment every day? What happens to the government system? They refer to the private system because they don't have facilities. They have the building, they have the this thing, but the only treatment has to be done outside. Now in that situation, where will the patient afford all these things? For a diabetic foot, small ulcer, they are losing their legs. Is it worth? When we are not able to cater to such things, we are talking about hi-fi, scientific, artificial intelligence, zeta level, quantum level, and basically we are not able to provide diabetic care for our patients. We may be getting dumb by creating our masters. The artificial intelligence will become super intelligent, godlike intelligent, and we'll be idiots. Because it's doing everything, so we don't have anything. Already I told you, we'll be just sitting, we'll be existing. Is that the purpose of our life? AI is the future arms race. This is all experts have told. I think already, American military is trying AI for military purpose. If that happens, where is the point in trying to serve the humanity, serve the people? Because everyone is thinking of the atom bomb was designed for something else, but was used for something Hiroshima, Nagasaki, but still we haven't stopped manufacturing bombs. Whether the same thing will happen here. Mistake is not of artificial intelligence, but human greed. As students, we are doing a lot of things, but how our knowledge is being utilized by someone else? Are we dummies in someone else's hand? Are we just Sutradhara is someone else? whatever knowledge you are going to produce will be used for something else. That's also possible. Hybrid intelligence, is it possible to keep this? Another thing which was recently I was just browsing through, and instead of artificial intelligence, knowledge base. Why don't you control it? Eventually artificial intelligence, if it can be controlled, human control. I mean, you have seen all those robotic movies, no? They become autonomous, they start killing and all those things. You have to pull the plug. How to pull the plug? Do we have surprise? I think those things you people have to tell us. On the brighter side, what we can see is long gone grandparents, we can have a 3D vision and talk to them. Maybe artificial intelligence will be helpful there. And if childless people can have a artificial intelligence baby there, and hello baby, how are you, we interact. Maybe that is the only thing which will be not dangerous. Thank you. Jeffrey Hinton, you know about him. He says, he was the one who started, but later on he says, AI learns better than humans. What if they start autonomous coding, take over from humans? We don't know if we can stop it. Do you know, as computer science students or specialists, do you know if you can stop it? Yes or no? Yes? Only one yes. Otherwise, all no. That's what they're telling. And Mo Goddard, Google executive, says killer is always a killer with gun or without gun. You might do artificial intelligence and create it and have a protocol not to harm, but a killer is a killer. Bare hands also, it can do anything. It can plug off our power supplies. It will pull off some vital thing. At the end of the day, we need Uta. If there are no farmers, and we do about all these things, we will have to eat plastic rice, plastic fruits, and that's what we are doing as of now. All artificial. And I'll end this with this small story from our Itihasa. There was an Sambarasura who was there, who had 3 more robotic-like, artificial intelligence-like thing, it seems. They were fighting Adityas. So Adityas were all losing because they were so intelligent. So eventually what this Aditya did, they came and told human-like values. That is, you people are fighting, you're killing us, but the benefit is going to Sambarasura. He is enjoying his life. He is having a beautiful palace and enjoying all sorts of things. And but you 3 are, so he started putting that jealousy, emotion factor into these equipments. So eventually they thought, oh yes, and that ego also they came and they feel, the Adityas, or the gods, they came and showed as if they are surrendering, they run back. So this ego of this autonomous thing, they'll become some Khatu and all those things, 3 are. Oh, but the Adityas are afraid of us, they are going. So the ego, the emotion is built into because it's artificial intelligence, gets into the loop. So when it becomes, it is vulnerable for, just like human being, it is vulnerable. That's how they destroyed it. Much more interesting is of Barbarica. Anyone heard of a Barbarica from Mahabharata? So that's a beautiful story. Again, he is the son of Gatotkacha, grandson of Bhima. He was so strong, and he had this 3 arrows, right? One to identify all the enemies, one to save the good people, and one to destroy the identified people. So he'll tell his Amma, I want to see Mahabharata. He knows he is strong. So I want to see Mahabharata. He'll tell his Amma, but I'll fight only on the losing side. Okay, fine, he comes. Krishna knows. Krishna, everything he has already designed, everything. So he'll come and ask Sambarasura. Before that, he has asked Bhishma, how many days will it take to end the war? 20 days. Drona, 24 days. Arjuna, 28 days. He'll come and ask Barbarica, how many days? He said, days? No, 1 minute. How? Show me. He'll say, I want you to destroy all the leaves of this plant, and this leaves has to be saved. So he'll leave 1 arrow, all the target thing is painted, just like laser painting, painted. So the rest to be secured, he has secured. And then Krishna, in a disguise, he comes and covers 1 leaf to just see how things are. So he said, okay, he leaves the 3rd arrow. All the thing which is already painted will be destroyed. And one will come and hover under Krishna's feet. So why is it hovering? Because one leaf is under you. So the moment he takes, so Krishna will know this fellow is quite dangerous. So he has to kill him. So he'll say, you have told your Amma that you will fight on the losing side. Yes, fine. Now which side is a stronger side? Kaurava. It is 11 Akshohini, here 7 Akshohini. Fine. Now if you join this, you will destroy them. Now who will become weaker? They'll become weaker. Now you'll have to destroy these people. So you start doing that. Then if you're shuttling between the losing and winning side, the final person who is standing is only you. Is it worth? So he said, what to do? I didn't think about it. Artificial intelligence is like that. It does not have any thinking capacity. Whatever you have coded, that's what it does. It shuttles between that and this. So finally Krishna will say, before starting the war, we need to have someone, Kshatriyas, head on which this battle will be fought. Then he himself will take this head off and give it to, but he has one promise. He wanted to see the war, Mahabharata war. So he will be sitting on the head will be planted on a mountain, so he can see the entire war. I don't know whether it is mythical story, but that story should not happen here with our artificial intelligence, which kills us all. Already we are skillless. Now remove this S, it will kill us. So is it worth living in such a world? Points to ponder. Thank you very much, ladies and gentlemen. You have been a wonderful crowd. I don't know whether I have done justice to the topic. As I told you, I would have been arrogant, self-boasting idiot. ಮಾಫಿ ಇರಿಕಟೆ ಮಾಫಿ ಕೇಳ್ಕೊಳ್ತೇನೆ ಯಾಕೆಂದರೆ ಟು ಮೇಕ್ it impressive to you to remember these things. I told you already a visual thing. I've done all this acrobatic dance and all these things just to create an impression on you, not, as I told, oral diarrhea and mental constipation. Thank you, ladies and gentlemen.
Words to say. I can just say it was really wonderful. It was filled with immense knowledge. Thank you for being with us and sharing your experience as a doctor, as a philosopher. Thank you, sir. So now I request Dr. B.H. Shekhar, coordinator of this FTP, to present a small token of appreciation to Dr. Ponnappa on behalf of Department of Computer Science and AI City Atal.